Hi, my name is Linda Okafor. In this week 8 in clinical, I encountered a deeply moving case involving an adolescent whose mother has been diagnosed with terminal cancer. The patient, a 17-year-old girl, was brought in by her father, who expressed concern over her increasingly withdrawn behavior, difficulty sleeping, and recent drop in academic performance. This was the first time I encountered a patient dealing with such profound grief and anticipatory loss at such a young age. This case underscored the complexity of adolescent mental health, especially when layered with significant life stressors like a terminal illness in the family. It expanded my understanding of how grief and anticipatory loss can manifest as symptoms commonly associated with depression or anxiety in adolescents. I learned that in such cases, it is crucial to differentiate between typical adolescent behavior and symptoms that warrant clinical attention, while also considering the broader context of their life circumstances. This interaction highlighted the importance of building a trusting relationship with young patients, especially when they are dealing with sensitive issues. I had to carefully balance providing space for the patient to express her emotions without overwhelming her or making her feel pressured to talk about her mother's condition. I realized that establishing a safe, non judgmental environment is key to fostering open communication, which is particularly challenging yet essential when dealing with adolescents. One of my strengths in this interaction was my ability to empathize with the patient, validating her feelings of sadness and fear. I focused on being present and attentive, allowing her to set the pace of our conversation. However, I recognized a limitation, my discomfort with prolonged silence. There were moments when I felt an urge to fill the silence, which could potentially disrupt the patient's processing of her emotions. This realization highlighted the need for me to become more comfortable with silence, as it can be a powerful tool in therapy. Reflecting on this experience, I realized that my therapeutic use of self, my ability to be genuine, empathetic, and present was central to connecting with the patient. I also recognized that maintaining a calm and steady demeanor, even when the patient expressed intense emotion, was crucial in helping her feel supported. This interaction taught me the value of patience and the importance of allowing the patient guide the session rather than rushing to provide solution or intervention. One specific insight I gained from this experience is the importance of addressing the emotional needs of the adolescents dealing with complex family dynamics, such as parents' terminal illness. I learned that it is essential to assess not only the patient's current symptoms, but also the broader impact of their environment on their mental health. Moving forward, I will apply this learning by taking a more holistic approach to adolescent mental health assessment, ensuring that I consider the influence of family dynamics and life stressors on the patient's well-being. This experience reinforced my commitment to the psychiatric mental health nurse practitioner role, emphasizing the importance of empathy, patience, and the therapeutic use of self in building strong, supportive relationships with patients, particularly those navigating life circumstances. Thank you.